An estimated 1,000 people die in hospitals every day in America from preventable errors.
A 2 News investigation into deadly medical mistakes continues tonight after a Springfield man's death. Natalie Tendall is asking if the healthcare industry is doing enough to keep that number down.
The Journal of Patient Safety estimates that hundreds of thousands of patients go into a hospital every year but don't come back out because of preventable medical mistakes. Their data would suggest medical mistakes is the third leading cause of death in America. Tonight, I ask what's being done about it and why patients don't have the right to know how many their hospital has had. From the wrong diagnosis and medication to operating errors and preventable infections, it's no secret things go wrong in hospitals. But data shows too many of these deaths are preventable.
There's never going to be enough money that'll ever bring our father back. But the biggest thing I want is for them to never be able to do this to somebody else's family.
James Frock's father died after a piece of medical equipment dropped into his airway during a procedure at Springfield Regional Medical Center. The hospital says their heart goes out to the family, but won't comment further because Frock is suing. He says his father should not have died during that procedure. Would you say that medical mistakes are more common than people think?
Absolutely. You know, in terms of public awareness, I don't see as much interest in this area as
we tracked down Dr. Tejal Gandhi and interviewed her via Skype. She's the president for the National Patient Safety Foundation. So you would say, doctor, that there is a need to improve patient safety?
Absolutely.
2 News Investigates found hospitals in Ohio are not required to report their medical mistakes. And if they do voluntarily report, those numbers are not available to patients. Dr. Gandhi believes that should change.
But I think, and it's in transparency with the public is critical, transparency between organizations is really important so that organizations can learn from each other.
She says the goal would be to not just report the mistakes, but learn from them so health organizations can improve. Dr. Gandhi spoke at a Senate subcommittee hearing in July about this very issue. She, along with several other leading health experts, say the system needs to be redesigned.
Do you have the right process in place? Do you have the right checks and balances? Do you have the right resources? Do you have the right IT systems?
Frock says the unnecessary loss of his father has him thinking about health care in a new light.
If they don't change something, our society will never want to step foot in the hospital.
Dr. Gandhi says to do this properly, we will have to move away from blame and punishment and focus more on the solution.
To err is human. Every human being will make a mistake. Can't fire everybody. We won't have anybody left. So how do we design our systems so that they catch errors with the assumption that human beings will make mistakes?
We mentioned tonight at 6 that patients don't have access to the medical mistakes data, but you can check to see if any formal action has been taken against your doctor. We've posted a link to that database on our website at WDTN.com. Look for this story under the Investigations tab. Natalie Tendall, 2 News Investigates.
And this story began with a tip from a viewer. So if you have a story you would like us to check into, send an email to 2 News Investigates at WDTN.com.